The Southern Regional Health Authority is one of 4 regional authorities that emerged from the National Health Service Act of 1997. The Southern Regional Health Authority ensures effective health care delivery to the residents of Manchester, Clarendon, and St. Elizabeth. It is managed by a board of directors comprising of 14 members appointed by Cabinet.
I am Sean Brissett, Parish Manager at St. Elizabeth Health Services. In this COVID-19 fight, we have had many partners. And from day one, we recognize that the health services could not do it alone. But I wish to speak firstly about my staff, and they have been my greatest partner. At first, we recognize that we have to draw on all resources. For us, there are frontline staff, meaning that there are persons who are face to face with persons infected with the virus. However, there are other persons who are very working behind the scene and making sure that it happens. So in other words, I have a 100% dedicated set of staff members. This pandemic has brought significant amount of uncertainties among the staff. And there's one report that indicates that in St. Elizabeth, psychotic moments have increased by about 80%, which is significant. And no doubt you would have expected a similar kind of circumstances occurring among the staff. Sometimes the staff at first felt alone, this fight, and particularly when they are feeling the resistance from persons within the society. However, we had some very good partners who came on board to help us to carry some of these burdens. And this has become a journey in which, as you travel the road, you find persons coming along, running along.
My name is Delroy Slowly. I am the Member of Parliament for St. Elizabeth Northeastern. Along with my company, True Bargain Hardware and Construction Company, we have been partnering to a large extent with the health center with the fight against this COVID pandemic. I have seen the situation unfolding in front of my very own eyes. In many communities, I've seen where we have lost mother, father, and child, all being buried at one day. So in terms of partnering with the health center, this started from way back even before my becoming Member of Parliament. But especially since the onset of COVID, we've had a more vigorous partnership. I remember seeing the crowds gathered at the gate of the clinic, passing at times, and I felt drawn that I had to do something. At times I would stop by just to see how things were happening. Little by little, it evolved into providing water for some of the patients, water for the staff also. And it went further into at times where I provided lunch because I saw the need. I realized that, it's as if we were literally fighting a war and the enemy was unseen. And I had to get involved.
My name is Gregory Neal, Managing Director, Stainless Construction, operating out of Santa Cruz, St. Elizabeth. We provide service in sanitation, sewage system treatment, general construction, metal fabrication, tank erection, structural steel erection. I've been in partnership with Southern Regional dating back to about 10 years, providing various services. I've moved the service into sanitation, providing portable toilets, portable hand washes, sewage service, the kind of service that you need now to keep operations going. So, I've tried to be a bit reliable, the kind of person that they can call and you get things done.
I'm Jason Hensel, CEO of Jake's Hotel, Villas and Spa here in Treasure Beach, St. Elizabeth. We've worked very closely with the Southern Health Regional Authority. Sean Brissett, being the parish manager here in St. Elizabeth, has made a big difference. We have had a relationship from before COVID, but it's become a lot more stronger since. Just watching as they, mobilize clinics, health centers, the hospital across the parish. I'm encouraging all of corporate Jamaica to do that, to seek this partnership, because together we are stronger.
At the head of the Southern Regional Health Authority is the Regional Director, Mr. Michael Bent, who is responsible for the day-to-day administration, directing and controlling the development of strategic and operational plans for health services in the region, and the directorates who are responsible for the various arms of healthcare delivery across the region.
Yes, I'm Michael Bent, I'm the Regional Director for the Southern Regional Health Authority. The Southern Regional Health Authority are the parishes of Clarendon, Manchester and St. Elizabeth. So we offer public health services to persons within these parishes. With the onset of COVID-19 pandemic in March 2020, the region has been impacted in many ways. First, the number of cases. We have had quite a number of persons within the 3 parishes who have been contracted by the pandemic. We have also had a number of deaths and also a number of hospitalizations. In some cases, we have hospitalization resulting in overcrowding in some of our facilities. The other impact is that it would have caused the staff to be, I would want to describe it as being really overworked. But thank God we have a committed staff members who are consistently going beyond the call of duty. We have also lost some staff members as well, in terms of who have died from the result of the COVID-related disease. Now we are in another phase of the pandemic in terms of responding. So we are actually at this stage of administering vaccines. So far we have administered over 184,000 doses of the vaccine, that is the AstraZeneca, Johnson & Johnson and Pfizer. Since the pandemic we have essentially expand our cadre of partners, that is both the private sector, civic groups, faith-based organizations. We have had partnership established with the ordinary man on the street. You'll be surprised to see their response to us. And so because of the partnership, and I must also say that this partnership is not just for persons locally, but throughout the diaspora. And that has been quite good. We have been gifted with things like additional beds, additional medical equipment. We have been gifted with things like PPE, that is personal protective equipment. We have been gifted with baskets for staff, because of course the staff welfare is very, very important as we respond to this pandemic. We have been gifted with persons volunteering in terms of assisting in counseling and motivational talks to keep the staff focused. We have been gifted in so many ways, and we are really thankful for that.
Dr. Vitilius Holder, Regional Technical Director, is responsible for coordinating the technical programs in primary and secondary health care within the Southern region.
I'm Barbara Ellington, and I'm the Resource Mobilization Officer here at the Southern Regional Health Authority. I am tasked with finding donors in corporate Jamaica and in the diaspora, more so the diaspora, to donate funds, equipment, supplies, hospital beds, all of those things that we use in the business of healthcare in the sector. As with the rest of the regions throughout this pandemic since last year, we have been severely affected. Our resources have been stretched to the limit. Corporate Jamaica and Jamaicans in the diaspora, especially people who live overseas and were originally from Mandeville and its environs, they really stepped up to help. So that takes me right into who we have partnered with. So we have partnered with Most of our suppliers who we would normally purchase things from locally, a lot of them have come around and given us, donated, especially PPEs and things like sanitizers and rubbing alcohol and gloves and all of those things that we need. Here in Mandeville, for example, recently we got 10 mattresses from Villa Pharmacy. I can think of the Manpower and Maintenance Services organization run by Mrs. Audrey Hinchcliffe. They also stepped up early in the game and gave us quite a number of supplies. Every supplies gave us 50 boxes of gloves recently. Private citizens, people from the NCU, they go into the hospital and they see the need and they respond by donating items that are in need. Our Custos has stepped up to the plate. He's always with us when we go out on vaccination blitzes. There are so many partners overseas. I can think of the Push Start Foundation. I just got a call this morning that supplies meant for one of the hospitals in the region are ready for us to go and pick up now. Just last week I was in Montego Bay collecting food, because you know that is another huge area of need that has opened up during the pandemic, and donors overseas have sent food and we make up packages or we give directly to Ebenezer Home, which is under our care. New Vision Children's Home up in Colleyville, they send food. And just for people who are shut in, places like Candle in the Dark, who feed the homeless every day. So the donors overseas, there are so many foundations. American Friends of Jamaica, they're another valuable partner. I don't know what we would do without them. And I get the calls almost weekly. Right now, another partner is coming all the way from England at the end of this month, and she will supply us with vital equipment that we need as we try to fight the COVID-19 pandemic. So I'm happy to say that yes, we do have extremely valuable donors and partners in this fight against COVID.
Each parish is managed by the parish manager, who directs and controls the development of strategic operational plans for health services in that parish. In addition, there are hospital management committee comprising of representatives of professional and community groups.
If you give a little more than you take, and if you try to fix more than you break, if you're the kind who takes the time to help a stranger in the rain, there's a place for people like you.
I am Nadine Williams, the Medical Officer of Health for the Parish of Manchester. As the Medical Officer of Health, I am the technical lead on matters pertaining to public health safety in the parish. Thankfully, in the Parish of Manchester, there are persons and individuals and organizations who recognize that they have a part to play and have been doing that over the years. Our partners were instrumental in assisting us in establishing our Emergency Operations Center, our temporary step-down facility, and other organizations were there to assist us in carrying out our health promotion education activities, whether through distributing information, education, communication material, through creating flyers, banners, town criers, and just sharing the information as much as possible on what persons need to do to keep safe during the pandemic. We also have the Manchester Municipal Corporation group of councillors led by Mayor Mitchell, who have always had our back throughout this pandemic. And we know we can call on them at whatever time of day and whatever support that we would need. We also had the backing of our members of parliament and a slew of private business entities that have been there to support us in one way or the other, whether it is in cash or kind. And we just want to say a big thank you to all of our partners, because without you, we would not be able to reach where we are at this point in time. Thank you once again.
I am Sandia Chambers Ferguson, Parish Manager for the Manchester Health Services. My role is to manage the activities of the integrated healthcare delivery services in the Parish of Manchester, ensuring that the mandate of the Ministry of Health and Wellness is executed with effectiveness and efficiency to all our clients. As a result of COVID-19 pandemic, the Manchester Health Services had to put some measures in place to deal with the challenges that we faced. We first established our Emergency Operations Center to monitor COVID-19 cases in the parish, dealing with testing, contact tracing, and monitoring our clients in isolation and quarantine. The female ward at Percy Junior Hospital was retrofitted as an isolation ward, creating additional space for our COVID clients. As a parish, we continue to implement strategies to contain COVID-19. However, we could not do it by ourselves, and so we had the support of our partners. And we want to say a big thank you for coming on board and giving us that level of support. We established partnership with public and private organizations in the parish, working with the police, the JDF, and the Office of the Customs of Manchester to inform and educate our citizens within communities about COVID-19. The Customs was very instrumental in organizing for JPs to give assistance at the vaccination sites across the parish. Our private sector partners have given support in all areas in the parish, and we want to say a big thank you.
I'm Garfield Green, Custos of Manchester, and boy, the COVID-19 pandemic has really caused my office to get really, really busy. It has also helped me to meet a lot of people within the parish, because since the COVID-19 pandemic, I have personally been out there to meet the people, to bring the message to them, to encourage them to come out and get vaccinated, right? Or for them to adhere to the protocols. And this was before we had the vaccination started, yes? So it has really kept my office busy. There are a number of donations that have come through my office for the health sector, for the people of the parish. So both ways, getting to the people and getting to those sponsors who wanting to help us here in Manchester to fight it. We had the PPEs, that's personal protective equipment, such as the mask, face mask, sanitizers, and other necessary supplies that we distributed right across the parish. We went into the communities and we distributed them. On board, we also had the police coming along with us. We saw it was really necessary for all of us to get together. In the end, well, it's not the end, but at this current point where we are in fighting the pandemic, I have received a commitment from some of our justices of the peace to work at the vaccination sites, right, to ensure smooth operations, to help the workers there. And I have to say, we have to recognize the healthcare workers who I know continue to work courageously for the health of our citizens, for the well-being of our citizens, and to help the country to get back to normal.
In line, your friend at school or your co-worker may have COVID-19 and not know because they have no symptoms.
Okay, the Ministry of Health and Wellness, the Clarendon Health Department, we're here live in living colors, and can I tell you something? We did it in Manchester and it was spectacular. It was something to talk about. Now we're at 2 locations today, Bargain Village Plaza and right here at the clock in Maypen Square. Today we're offering 2 COVID-19 vaccines, and that's Johnson & Johnson and AstraZeneca. All right? From morning, our healthcare team, our nurses, our doctors have been out in their numbers, assisting persons, and can I tell you, the location of one good.
It's a girl Shensia with a message to you from myself and the Ministry of Health and Wellness. Shenyang, everyone be wear a mask with the numbers.
Good morning, I am Kimberly Scarlett Campbell, Medical Officer of Health for the Parish of Clarendon. Well, the COVID-19 pandemic has really negatively affected the Parish of Clarendon. We have had to create an isolation ward for COVID-19 patients. Most times it is full. We have had several deaths, a lot of disability. We have had an increase in mental illness in our parish as a result of the COVID-19 pandemic. Well, the Parish of Clarendon has had 2 quarantines. Remember the Cornpeace quarantine and the Sandy Bay quarantine. So we have had to partner with quite a number of persons in civil society. Some that come to mind, Nation's Choice, the Costas Rotolorum of Clarendon, Juicy Patties, the Clarendon Municipal Corporation, persons in the business community, Mrs. Lorraine Mason, and other members, this SDC has been a very good partner of us as well as regular persons who want to assist the health department. You have persons from church groups, faith-based organizations. They have been giving us lunches, business operators, Morris, from Morris in Clarendon Park. So we have had quite a number of persons coming on to assist us. So we have appreciated that a lot. And also the Jamaica Agricultural Society.
Shenyang, everyone be wear a mask with the numbers drop. I don't want COVID, lay you down flat.
My name is Winston Mirage. I'm the Mayor of Maypen. And of course, I represent the Rocky Point Division as councillor. But I'm also a chairman of the HR committee of the Southern Regional Health Authority Board. And as the chairman of the municipal corporation, I'm also chairman of the local board of health for the parish. The COVID-19, ever since it started, we have been having problems, nothing but negative problems in Maypen town. Just looking at the bank lines, just looking at the lines that are there going into the business places. A lot of people, by the end of the day, they will not be able to go into these places to do their shopping. The businesses are suffering and the people are suffering. Well, of course, we have been partnering with the Clarendon Health Services, the health department. We have been partnering with the Southern Regional Health Authority. The Clarendon Municipal Corporation is on board, and we are on board to get rid of this wicked virus as quickly as possible.
The Southern Regional Health Authority delivers services through its network of 72 healthcare centers and 5 hospitals. Serving virtually and physically in the new space are approximately 3,750 health and administrative workers.
My name is Lilith Campbell. I am a Deputy Superintendent of Police and the Zone Commander for South Clarendon. That will be Milk River, Exeter, Hayes, Lionel Town. The pandemic has really stretched our resources. For instance, when we have Bliss, we have to send more police there, and we have managed to really control the crowd. We have more police at these Bliss, we have more police that we have to send out to parties to enforce, to ensure that there is no parties, no public event. So our resources stretch, but we do manage to send out teams. The team, the medical team and the police work in partnership. We mostly do the enforcement. We would accompany the medical team at times to Bliss, to Beach, and to wherever they are going and they need our assistance. So we are good partners and we try our best to work with them.
Good morning. My name is Christopher Parcell. I'm the manager for Bargain Village. The pandemic has affected the businesses in the plaza in a certain extent, in that in particular with overcrowding. I have been as helpful as I can with making some of the nurses at Maypen Hospital finding accommodation for them and making them as comfortable as possible, because without the frontline workers like those nurses and the doctors, we would be in even more serious problems.
Ladies and gentlemen, thank you for coming out to do your vaccine, whether it's the first dose of the AstraZeneca vaccine or it's the one-shot Johnson & Johnson vaccine.
Good morning, everyone. I'm Lorraine Green Mason. I am a businesswoman. I am also a board member of the Southern Regional Health Authority, and I am a patriotic Jamaican. All right, my business, Brody Super Save Wholesale, and also cover-to-cover books and stationery supplies. So in a discussion with my husband and my children, I told them that I was going to take on the task by myself. It took a while, but the initiative that I did, I honored all 600 plus healthcare workers in the entire parish of Clarendon Health Services, and I saw it fit to honor them because of their commitment and the sacrifices they have made to help to keep our country safe.
My name is Junior Wilson, owner of Stoplight Wholesale in Maypen here. All right, in general, this region, you know, we have a lot of people got sick. I've had customers and I've had close friends who have passed away, even fellow business persons in Clarendon who have passed away. We have donated refreshment because I remember when I went to take, me and my wife, we went to take our vaccine. You know, we see, you know what I mean, they were short of like refreshments and so, and I know the government can't do everything. So we decided to provide the refreshments, and any other way they call on us, we try to assist, right? Because we know it's for a positive cause.
At the heart of the organization are our external stakeholders, partners, who are our customers, suppliers, creditors, local community, volunteer, society, and government. All influence the long-term success and growth of the organization. Our vision: healthy people, healthy families in a clean and safe environment, continues to stand strong and unbreakable amidst the many constraints. The year under review has seen great success in spite of the COVID pandemic. This is a proud moment for us at the Southern Regional Health Authority to highlight and show work done, partnership created and sustained. This demonstrates our strength, resilience, and commitment in support of our logo, We Care. Compassion, accountability, respect, efficiency. Big up the committed team, Team Southern Regional Health Authority, home of champions.
Ask anybody, boy, I'm a big deal. I'm a friend, I'm a big deal. Yeah, we're kinda important.